Welcome back to the Toledo Clinic TV. Our guest at this moment is Dr. Louis Tartaglia, and he is a sleep specialist. Is that correct?
Correct.
Let's talk about sleep disorders. Most of us, in some way or another, are walking around sleep deprived or tired.
That's right. Americans generally don't sleep long enough, and they don't take naps in the afternoon, whereas most of the rest of the world takes a nap in the afternoon. America is a place where the highest rate of motor vehicle accidents occur between 2 and 4 in the afternoon, when most of the rest of the world is taking a siesta, or as in Italy they say a pisolino, a little nap. There are 3 basic types of problems with sleep. The first one is people that are too sleepy. They fall asleep during the day. They're not as alert as they would like to be. The second one would be people who can't sleep. They have trouble falling asleep or trouble staying asleep. And the third group would be people who go bump in the night, people who kick their legs or sit up and talk or have movement disorders during their sleep.
And all of them are very disruptive.
That's right, that's right. And there are many types in each group. So people who are excessively sleepy could be someone with apnea, obstructive sleep apnea syndrome, or they could have narcolepsy. They could simply have periodic limb movement disorder, which is a go bump in the night type of disorder, but it's so bad that it's disrupting their sleep. They could have upper airway resistance, where their nasal passages are really tight, and it's causing them to have partial awakenings. We call those arousals. And they do that frequently enough during the night, they wake up and they feel fatigued. There are people with circadian rhythm disorders. Teenagers tend to fall asleep later and they can't get up as early as they would like. And so in our society, we stay up late on the weekends. There's no evidence that is of any benefit except for socializing. And then for every hour you stay up late on a weekend, it takes a day for your circadian clock to come back to normal. And there are some people whose circadian clocks don't work well, so they don't come back to normal.
You began by saying most people don't get enough sleep.
Right.
What's
in America,
normal?
Normal should be about 7.5 to 8 hours of sleep.
For adults and kids?
No, children, it's more. So when a baby's 4 months old, they're sleeping 16 to 18 hours a day. But a teenager at 14 should be sleeping close to 9 hours a day. An 18-year-old should be sleeping 8.5, a 21 about 8, and after 25 years old, you should be sleeping 7.5 hours. Most of the world sleeps 6.5 hours at night and an hour nap in the afternoon. In fact, even factories in Asia allow their employees to take a nap in the afternoon because it increases productivity.
How important is it that Americans get quality sleep?
Oh, it's extremely important. It really is. When you're sleeping, you make a hormone called nesfatin, nesfatin-1. It's the hormone that allows you to feel full when you've eaten. So if you don't get enough sleep, you eat a little bit more because it's kind of God's way of programming the body. If you're going to work a little extra, a couple extra hours, you get a few extra calories. But let's say you have obstructive sleep apnea during the night, or something else is awakening you during the night. Well, you're not going to make enough nesfatin, you're going to overeat the next day. And if you eat a couple hundred calories a day for a month, you will gain 1 pound of fat.
And it can lead to some serious problems outside of just obesity.
Right, that's right. Well, we'll get into that when we talk about apnea. But there are many problems associated with apnea, including high blood pressure, heart attack, stroke, gastroesophageal reflux. And then there's all sorts of problems associated with people who can't fall asleep. Now they break up into, really there's 3 things we look at. We look to make sure there isn't apnea right at the sleep-wake interface. Just as they fall asleep, they're suffocating. That'll wake you back up. We look to see if there's poorly consolidated sleep during the second half of the night. That's usually associated with insomnia. That usually progresses to where then they can't fall asleep because they're worried about the fact that they're going to wake up too early. That also could be depression, can cause that. But mostly it's insomnia. And then there's restless legs. And restless leg syndrome is the urge to move your legs because you have strange sensations in your legs. It interferes with your ability to fall asleep. And often we see patients that are on sedative hypnotics for restless legs when they should be on medications for restless legs. And the sedative hypnotics always lose. They eventually lose. After a few years, they no longer work, and then we figure out that it's restless leg syndrome.
So what's the best way to diagnose, to find out a person does in fact have a sleep disorder?
The best way is to do a sleep study. You do a history and physical, and we take an extensive physical in our practice and an extensive history, where we look at all the different things that could be going on, and then we make a determination as to whether or not the patient needs a sleep study. A sleep study is fairly complicated because it's hard to see apnea, but we're able to distinguish parasomnias, we're able to distinguish apnea, and we're able to look and see whether or not it's insomnia or restless legs.
Are the disorders easy to treat?
I think they're fairly easy. I've been doing it for quite a long time, and it's a lot of fun. CPAP is very easy to institute. Once you get used to having a mask on your nose and you start sleeping better, it's fairly easy to do. There are medications for restless legs and insomnia. There's cognitive behavioral therapy for insomnia, and that's a little bit more specialized. I refer patients out to special therapists that are cognitive behavioral therapists for that.
All right, lots of good information. Thank you so much, doctor.
You're welcome.
All right, we'll be right back.